deaths and several cases of salmonella have been reported recently due to a nationwide salmonella outbreak.
State health officials say one of those deaths was of a woman from right here in Texas. The most recent outbreak being linked to cucumbers grown in Mexico. Federal health officials say nearly 350 people have been sickened in 30 states. More than half of those are kids under the age of 16. All the tainted cucumbers have been recalled, and joining us this morning to talk about salmonella is board-certified surgeon Dr. Garrett Peel. Thanks for joining us. This is scary. I heard about it and I kind of wondered, did they pull them all off the shelves? Is it safe to eat?
Yeah, even though they've been recalled, we seem to hear about salmonella pretty often. What is it and how does it get into our food?
Well, the Centers for Disease Control estimates every year 1.2 million illnesses and approximately 450 deaths happen because of salmonella in the United States. Salmonella is the name of a group of bacteria. It can spread into food if it is fertilized with contaminated manure, irrigated with contaminated water, or comes in contact with contaminated products during cutting, washing, packing, and preparation. It is one of the most common causes of the food poisoning in the United States.
So how do we avoid then getting salmonella? What can we do to prevent?
So most people infected with salmonella develop diarrhea, fever, and abdominal cramps between 12 and 72 hours after infection. You can also experience nausea, vomiting, a headache, and blood in your stool. The illness usually lasts 4 to 7 days, and most people recover without treatment. In some cases, the diarrhea may be so severe the patient needs to be hospitalized. In these patients, the infection may spread from the intestines to the bloodstream and then to the other parts of the body. In these cases, salmonella can cause death unless the person is treated promptly with antibiotics.
So who's at the highest risk of getting a salmonella infection?
Young children are at the highest risk. In
Unfortunately.
fact, children under the age of 5 have higher rates of salmonella infection than any other age group. Other adults and people with weakened immune systems are the most likely to have severe infections.
All right, and we can prevent it by just washing our food more thoroughly?
Yeah, avoid eating high-risk foods, including raw and lightly cooked eggs, undercooked ground beef or poultry, and unpasteurized milk. And keep food properly refrigerated before cooking. Clean hands with soap and water, obviously, with water before handling food, and clean surfaces before preparing food on them. And separate cooked foods from those ready-to-eat foods.
Right.
And do not use utensils on cooked foods that were previously used or used on raw foods. And do not place cooked foods on plates where raw foods once were, unless it has been cleaned thoroughly. So cook foods to a safe internal temperature, chill foods promptly after serving, wash your hands after contact with animals or their food, and don't forget, if you have any questions, certainly ask your doctor. So common sense here is very important.
Right, but sometimes we forget.
I was actually grilling over the weekend and I had several plates out there because I didn't want to put them on the same plate, and I almost got in trouble for dirtying all the dishes.
Separate.
Yeah, go through a million forks if you have to, but don't
Absolutely.
use that one with the raw meat on it.
You'll thank
Okay.
yourself later. All right, Dr. Peel, good to see you. Thank you so much.